Good morning, good evening, good afternoon. This is Dr. Garais for Laboratory BIO111, Unit 4. We'll be doing ocular anatomy and physiology today. So if you look at the instructions, of course we open up Anatomage, functional anatomy, and ocular applications, and then we're going to start messing with eye motions. Now in the I put a Microsoft Word document which has this all repeated from your original instructions, but at the bottom you will see a lovely diagram here of the innervations of cranial nerves 3, 4, and 6. And the muscles that you'll be looking at today are your superior oblique, superior rectus, medial rectus, lateral rectus, inferior rectus, and an inferior oblique. And knowing the muscles, just if you look at your medical terminology of each of the muscles, it tells pretty much what it does. So a lateral rectus, if you see here, lateral rectus, of course, you will turn the eye laterally or abduct the eye. And the eye that we're looking at here is your patient's left eye. And if they're looking medially, that's adduction towards the midline. And of course, superior rectus, rectus means straight muscle. So it's gonna pull them, if that muscle contracts, it's gonna pull the eye upward. Inferior rectus, pull the eye downward. Oblique will pull the eye diagonally. And you can also see a lovely color code here regarding innervations of your cranial nerve 3, 4, and 6. So, and a lovely mnemonic here, LR6, SO4, R3, right? So the lateral rectus is cranial nerve 6, superior oblique is 4, hence the term LR6, SO4, and everyone else is cranial nerve 3. And this is how the clinician tests your, not only your brain, the nerves, which are your cranial nerves, and also these muscles as well, okay? All right, so take a look at that, and also we'll be looking at the anatomy. So take a look at this as well, which is a nice little diagram, and I'll also have the actually 3D eyeball diagram, like one of these things here, a little model. So let's begin. Let's look at our instructions for this morning. And we are to look at functional anatomy, ocular applications, and select the eye motion, and then mess with some of the eye motions. So if we're here, we opened up, this of course turns it on, then we double clicked on the icon, and then what do we have? We have our menu here, and then we double click on functional anatomy, and then we find ocular applications. You know what? Let me hit the lights. All right, once it loads up, it'll load up to this screen. And the button that we're looking at is in the lower right-hand corner. And let's click on this button. And this button here, it'll bring up the eye, and then it'll have motions. All right, so if we're looking at the eye here, and we can highlight the muscles as well. Okay, so the muscles in red are the ones being contracted, because if you look, if it contracts, right, so the muscle will shorten and then pull the eye in the direction of the contraction, right? And those are your lateral muscles. Then you press on this button, superior and inferior rectus, and then of course combined with also your obliques, you can roll your eyes around, okay? And in order to get the colors for the highlight and muscles, click this button here. Okay, so that's the first part. I'm gonna go over that. And it can, what are the ones you need to answer Which muscles are present? What are their function? Well, when you play around with it, here's the clue. Well, it's not the clue, it's actually the answer. But again, full sentences. This is college after all. Next, we want to start looking at the eye, utilizing the Explore tool. And it is, I call it the invisible lady button. And then when you pick on things, they tend to disappear. So let's look at pupil, iris, ciliary body, and the retina. And we're going through here. Right. And then you can go find, that's the sclera, the outer coating. And in the lower left hand, I could remove certain things. So I click on that button. There you go. Then the sclera, the outer covering, I could remove it. I could also remove the extraocular muscles. Right? This item right here is the cornea. Then you have this item here, anterior chamber, posterior chamber. The anterior chamber has the aqueous humor or the aqueous fluid. Humor is a Latin word for fluid. Vitreous humor is the jelly in the back. And then you just go through, removing things and looking at what they are. That's the iris. Of course, the pupil is here. Then you have here the ciliary body. Vitreous body, right? Choroid plexus. Okay, the last part is the retina, and of course your cranial nerve too. Now, as you're removing things, you can bring them all back by this back button. Okay, and you can see everything came back. All right, that's what we're gonna do today. All right, you are responsible for, of course, when you look at this. I could ask muscles of the eye. Yeah, you know what? You need to know the muscles of the eye. And here's a nice little cheat sheet for you. Right. Of course, that will not be available the day of, but I might ask that. But these are more important regarding the anatomy. Do you know where your pupil, iris, ciliary body, and retina are? And of course, can you tell the difference between the vitreous and the aqueous humor with the lens demarcating the anterior chamber, which is your aqueous humor, or a watery fluid of part of your eye, and the posterior, which is the vitreous humor, which is the jelly-like fluid in your eye. All right, so pretty straightforward and easy laboratory. Let's see. And this part here is the aqueous humor right here. Then the lens demarcates the anterior chamber, and then the posterior chamber is full of jelly-like fluid here. You could see the retina, which is all in the back, and ends up into your optic nerve, cranial nerve 2. So for the eye, you need to know cranial nerve 2, 3, 4, and 6. All right? Okay, I'll see you in lab. Oh, last but not least, of course, today is the 17th, but the 24th, your last day, which is your laboratory checkoffs, just like your midterm, but the topics for identification will be, of course, the eye and the superficial muscles. Please watch this video. Well, you're watching this video. And of course, last week's video, which outlines all the structures you need to know. All right, see you in lab.